Ravi, let's set the stage here. You're a clinical researcher, right? You're wading through, I don't know, maybe hundreds of articles on cancer trials, journal papers, patient response data, regulatory documents, this never-ending pile of information. Friday comes, and the team expects what? A clear, actionable summary?
Oh, yeah, that sounds all too familiar. It's not just reading, though. You've got researchers cross-referencing biomarkers like PD-L1 expression, tracking response rates across different drugs, figuring out drug interactions, survival curves. It's honestly a perfect storm of data overload.
Exactly. So here's my question. Walk me through how Doc AI turns this chaos into, clarity. Like, where do I even start?
Sure. So, the beauty of dark AI is how it guides you through the process. First, you log on and create your project, like, say, immunotherapy trials for lung cancer. Then you select your sources, clinicaltrials.gov for structured trial data, PubMed for those in-depth research papers, and even drug approval docs straight from the FDA.
And let's say I've got my own stuff, like my own PDFs, spreadsheets, all that.
Oh, absolutely. You can upload anything: PDFs, images, tables, you name it. Doc AI systems, including OCR and NLP, parse through all that unstructured mess. So now you're looking at structured insights, trial endpoints, survival stats, adverse events.
So wait, no data coding, no cleaning, you're just, instantly ready to use it?
That's exactly it. Doc AI processes everything behind the scenes using models like BioBERT and SciBERT. It pulls out biomarkers, patient responses, everything, and then puts it into clean, sortable tables. If you have dealt with messy Excel exports, you know this is life-changing.
Wow, that's a time saver. No more wrangling with pivot tables just to find like one piece of relevant data.
Right. And what's even better is that the platform makes your findings searchable. You can filter them, visualize data trends, all within seconds. It's like shaving off hours, sometimes days, of manual prep. Now that you've got your data filtered and visualized, here's where things get really interesting. Doc AI isn't just about organizing what you have, it takes it a step further. It essentially becomes your assistant, flagging significant results or anomalies for you.
Like what kind of flags? Give me an example.
Okay, imagine this. You're looking at trials where survival rates go above, say, 60%. You can set an automation to flag those as high impact, or maybe tag studies where severe side effects exceed 10%. It's not just smart, it's proactive.
That's incredible. And you're saying it's this seamless, no complex rules to set up?
Exactly. The system uses straightforward inputs, even plain natural language. You just tell it what to look for. Alert me about trials with more than 50% response rates, for example, and it'll monitor for you.
I mean, coming from my own experience with automotive sourcing, those long, complex supplier audits, this could have saved hours, maybe days. Back then, it was like swimming through endless spreadsheets just to find one actionable insight.
Right. And it's the same principle here. Researchers don't just need data, they need usable insights. By structuring it, automating workflows, and letting them query naturally, Doc AI tackles the analysis bottlenecks head on.
And speaking of natural language, could we, say, just ask a question like, which trials had a greater than 50% response rate for PD-L1 inhibitors?
Absolutely. You could type that in and boom, within seconds, you'd see results like, say, I'm Power 150 or Keynote 189 with their response rates right there. It's like every query shortens the gap between a question and the answer.
Wow. So, no more manually matching endless tables or double checking numbers. That's got to be a game changer for anyone dealing with cross trial comparisons.
It really is. Researchers can finally focus on insights, not the grunt work. And when you add automation into the mix, the tool essentially works for you, preemptively surfacing what matters most.
So, Ravi, with Doc AI preemptively surfacing meaningful data the way you just described, How does it handle competing priorities? Like, say, balancing high-impact insights versus anomaly detection? Does the system prioritize for you, or is that still up to the user?
Exactly. Speed's only one part of it. The bigger win here is how Doc AI reduces human error in analysis. Imagine sifting through hundreds of studies manually. You or I could miss trends, or worse, overlook those outliers that actually hold the breakthrough insights.
Right, and without tools like these, breakthroughs might stay buried in data chaos.
You are spot on. Take, for example, a recent study on how AI identified specific biomarkers in rare cancer types. It turned out those were critical indicators for treatment response, information no one had connected before. Using traditional methods, that discovery could have taken years. But with Doc AI, it surfaced almost immediately.
That's incredible. But okay, let me play devil's advocate for a sec. What about ethics? If AI is doing all this heavy lifting, like flagging trends and automating conclusions, who owns that insight? How do we ensure it's transparent and fair?
Oh, that's a vital question, Amara, and one the entire AI community is grappling with. Transparency in algorithms, clear documentation, permissions on uploaded data, these are all essential. Tools like Doc AI need to continuously build trust by showing exactly how conclusions are drawn, sharing that process openly with researchers.
And ensuring data ownership stays with the researcher, not the tool, right? I feel like that's got to be non negotiable.
Completely agree. The researcher always has control here. Doc AI ensures you define the inputs, validate outputs, and keep all generated insights securely within your platform. It's a collaboration tool, not a takeover system.
Such an important distinction. Honestly, Ravi, today's conversation has made it so clear. Tools like this aren't just innovations, they're necessities. It's like researchers can finally breathe again, focus on solving problems instead of drowning in raw data.
Absolutely. AI isn't here to replace researchers, it's here to empower them to dig deeper, uncover trends faster, and make decisions with more confidence. That's the future of research.
Well, I think we've covered a lot. Data processing, automation, natural language queries, ethics. I mean, listeners, if you're curious about how Doc AI fits into your work, don't wait. Go explore it for yourself.
Couldn't have said it better myself. To everyone tuning in, thanks for joining us on this dive into the future of research. Exciting times lie ahead.
And on that note, we'll leave you with this. The next big breakthrough might just be one AI query away. Until then, stay curious, stay inspired, and we'll see you next time.